Hi everybody, it's Ashley of Day-to-Day Social Work. I'm a private online tutor and I specialize in assisting people to pass the license exam in social work on the master's and bachelor's level. You can find me online at daytodaysocialwork.wix.com/my site, and you can find me on YouTube at Day-to-Day Social Work. This video will be about several federal benefits programs that we have here in the United States, and I just want to make clear that these are federal programs that may be amended, for lack of a better word right now, in the different states. So everything may not apply to every state that I'm talking about here, but I am getting this information directly from the federal government websites, and I'll put those in the description box. But I wanted to do this video because I wanted to find up-to-date information on these programs, because you may come across some of them just mentioned on the exam and also in your day-to-day life in the field of social work, working with clients and patients and that kind of thing. So I just want to do a quick overview of all these things and just touch on each of them. If you have more to contribute to the conversation or to the information, then please feel free to do so in the comment section. And I'm thinking about starting a forum on the website so that people can talk about things and have healthy discussions about things, whether they agree or disagree on whatever topic is being discussed. But anyway, so let's see, and I've done some research on each of these programs just to get the basics. I'm not going into who founded them, what year, and that kind of thing, and I'm not going to go into statistics and numbers, but just giving you the very general information about each of these programs. Most of them we should be familiar with as social workers anyway. Some of them maybe not, because different people experience different things in different states and different parts of the country. So now, the first one that we're going to talk about is the School Meals Program, and this is a program through the United States Department of Agriculture, Food and Nutrition Service Department. So this was one that I just recently learned about, like literally 3 or 4 days ago. It's called the Community Eligibility Provision. So I came across this because I'm always trying to give back in my hometown. I did the book scholarship at my high school, and since I kind of stopped doing that for right now, I wanted to find another way that I could give back to the community. And so I thought about the fact that there are a lot of kids who can't afford to buy breakfast or lunch every day. When I was in high school, I think breakfast was like 35 cents a day, and then lunch was like, I don't know, maybe $1 and something. I can't remember. So I grew up in a low-income family, single mom, but we were definitely probably at or below the poverty level financially, but I definitely had a great life growing up. I didn't feel like I was abandoned or missed out on anything, and definitely had fun, was loved, supported, cared for, and here I am today. But anyway, and that's another thing. Just because people are low income or at the poverty level doesn't mean they're bad people or they're stupid people, and we know that. I mean, we're social workers, but there are some social workers who they still don't get it, and so they have to learn those kind of things. But anyway, but I'm pretty sure the majority of us know that. But anyway, so the Community Eligibility Provision is a program, like I said, that I just found out about because I was going to call to the superintendent, who used to be my middle school principal, to ask him if I could donate money to give to make sure that the kids who can't afford, or not all of them, of course, because I don't have money like that, but if I could donate a certain amount of money to be allocated to children who couldn't afford breakfast or lunch. And so I went onto the school's website to just look around and see how much it costs for breakfast and lunch now, since it's been years since I've been in middle and high school. And I found out that now everybody gets free lunch at my middle school, high school, and elementary school, because it's in a disadvantaged / low income area. So I was just shocked to find out about it. So I was reading about it, and it's called the CEP, Community Eligibility Provision, and I pulled up the website, and it's The community eligibility provision is a non-pricing meal service option for schools and school districts in low-income areas. CEP allows the nation's highest poverty schools and districts to serve breakfast and lunch at no cost to all enrolled students without collecting household applications. Instead, the schools that adopt CEP are reimbursed using a formula based on the percentage of students categorically eligible for free meals based on their participation in other specific means-tested programs, such as SNAP, which we know is the Supplemental Nutrition Assistance Program, and TANF, which is the Temporary Assistance for Needy Families program. So that's what it is. If your school or your child's school or whatever is in a certain area that is classified as low income, and every state has different qualifications on what that means, but from this, what I gather is if there's a certain number of people or families that have SNAP or TANF or other benefits, then that area qualifies for CEP. And definitely the place that I grew up in definitely qualifies for that. So everybody in the middle school, the elementary school, the high school, everybody, no matter what the family's income is, no matter financially how stable they are, none of that matters. Everybody gets free breakfast and free lunch. So I was like, wow, I'm trying to give back, and I didn't even know about this program. So then they have a list of eligible schools, and the LEA is the local educational agencies. So when I was looking up information, I found that there was a certain percentage of people in those areas, and it was like 60 something percent, 74%, and all these other things. So I think there has to be a certain percentage where that area qualifies. So I will put the link down below so that you can look at your state and even down to your specific school district and your school itself, the name of the schools. Well, I don't know if they had the names of the schools. I think they did. But I'll put all of that, well, not all of that, but the links to those in the description box so you can check it out. So that's good to know too, because that's something that might pop up on the exam when we start talking about school social work. And that's what I'm really looking for today, is just school social work stuff, because a lot of people have said that so a lot of school social work on the exam. I haven't seen the exam. I don't know. The actual exam, of course, none of us see it, but we know the content that's on there based off of the outlines of the exam, but nobody knows what's exactly on it. So I think it's good to just know what the school, some of these federal programs and some of the other stuff that I mentioned in the other videos today. So that's that one. And then these are just going to be some quick overviews, quick summaries of a few other assistance programs or benefit programs. This information comes from the Food Research and Action Center.org website. Again, this is all federal information, so things could be different where you are. But they have the after-school nutrition programs. And so let's see. The after-school nutrition programs provide federal funding to serve nutritious meals and snacks to children and teens at schools, community and recreation centers, boys and girls clubs, YMCAs, and other sites that offer educational and enrichment activities after school, on weekends, and during school holidays. So after-school meals and snacks are provided through the Child and Adult Care Food Program and the National School Lunch Program. These programs are administered at the federal level by the United States Department of Agriculture, USDA, and in each state, typically through the Department of Education, Health, or Agriculture. So, again, these are federal programs that are handed down to the state levels, and then they allocate whatever based on whatever policies they have in your respective states. Let's see here. Then I thought they had something else on here, but that's what that is. And this will give you more information about what the Child and Adult Care Food Program and the National School Lunch Program are. And I also have a little bit of information on that. So again, these programs that are providing education, enrichment activities to kids after school are or can receive federal funding. So that's that one. And then again, another one from the Food Research and Action Center is the School Breakfast Program. I'm not sure if this correlates with the CEP that I just talked about first, but could be. But it says the School Breakfast Program provides millions of children a nutritious morning meal each school day. School breakfast is a critical support for struggling families trying to stretch limited resources and provides children a significant portion of the nutrition they need to learn and be healthy. So, and then they also have on here that the FRAC, which is the Food Research and Action Center, has, where did it go? Is a proud partner of the Partners for Breakfast in Classrooms, a consortium of nutrition and education organizations, including, and then they list all these different things, but they have grants available, so you can find information on that there. And it says any public school, nonprofit, private school, or residential child care institution can participate in the school breakfast program and receive federal funds for each breakfast served. The program is administered at the federal level by the U.S. Department of Agriculture and in each state, typically through Department of Education and Agriculture. I feel like we already read that, but anyway, it's listed again. But anyway, so there's information on that. And then another one is the SNAP program, which was formerly called the Food Stamp Program. And most of us know about SNAP or food stamps just because it's always a hot button topic when it comes to benefits and that kind of thing. And we know that the SNAP program is the Supplemental Nutrition Assistance Program. And it says by providing monthly benefits to eligible low-income people to purchase food, the SNAP program plays a critical role in reducing hunger, malnutrition, and poverty, and improving family security, child and adult health, employment, and other outcomes. So they have some quick facts here. It says that SNAP helped lift 3.6 million Americans out of poverty in 2016. The federal government pays 100% of SNAP benefits. Federal and state governments share administrative costs, with the federal government contributing nearly 50%. And they go on to give some more information about how it used to be called the Food Stamp Program until October 1st, 2008. And it says every 5 years, SNAP is reauthorized by Congress as part of the Farm Bill. The reauthorization establishes who is eligible for SNAP and addresses program access, benefit levels, and other matters. And if you are the kind of person that stays informed with local happenings and national happenings with benefit programs and all that other kind of stuff, a few months ago, maybe like 2 or 3 months ago, or maybe it was just about 2 months ago, there was this whole big fuss about how they were thinking about changing the SNAP program kind of to how it used to be back in the day, from what I've heard, where they give you a box of food and have different little items in there for you instead of giving you the electronic benefits transfer card, which is also known as EBT card, and putting a certain amount of money on there so that people can go and buy the food themselves. But again, make sure you are well informed when talking about things like this, because it wasn't for everybody. It was for people who received over a certain amount or were eligible for over a certain amount of benefits. They would receive a box, and then the rest of their benefits would be on the card, I guess. So it's just a whole lot of stuff to keep up with and to make sure that you know about these programs. That is not going into effect. That was just something that was in the news as a current event that people were talking about. It's not going into effect as far as I know, and people really haven't said much else about that. People felt differently about it, of course. because there are people who fraud and scam the system, of course, but there are many more who definitely benefit from these assistance programs and who need them. And even though they're on them, they don't really help a whole lot. I have, as you know, I'm an ambulatory care manager, and I work with elderly people who have chronic illnesses, and a lot of them are on fixed incomes, and some of them don't even qualify for food stamps, or SNAP rather, and they tell me all the time that they don't even want to fill the paperwork out because they're only going to get $12. And then some people say, well, you should be grateful that you're even getting $12 and that kind of thing. But so there's the whole big thing about that. But there are people who don't make enough money to live, yet they don't qualify for food stamps either, or SNAP either. So it's just a lot that can be said, and I won't go off into a whole tangent about that because everybody has their own thoughts and opinions about that, and that's not what we're here to do. But I'm just here to inform you about these programs. So that's another one. And then this is one that was new to me, National School Lunch Program. Not the program, but the Anti-Lunch Shaming Act of 2017. So it says the Anti-Lunch Shaming Act, and they have the bill numbers and things, would end practices that single out children who do not have enough money in their school lunch account or in hand to pay for their meal. The bill was introduced by senators, and then they named them, and representatives, and then they named them, and addresses lunch shaming practices that can embarrass children in the cafeteria. So I thought that was interesting. I don't know if that's something that, I don't know exactly what that is. I have to do more research on it, but I mean, I can definitely see how that is a problem, especially being a child who did not qualify for free lunch because my mom made too much money, but we were still at the poverty line. So some days we couldn't have lunch. Some months we couldn't have lunch every single day and that kind of thing. So it is embarrassing because you have to go outside. Everybody else gets to eat. Maybe your stomach is growling, that kind of thing. You can't focus and that kind of thing. So I think it's really good that they started that CEP program. That was the initial one that we talked about, where if you live in a disadvantaged area or a low income area, then everybody, regardless of your financial situation, gets a free breakfast and free lunch. So maybe that's somehow tied into this. The National School Lunch Program, the nation's second largest food and nutrition assistance program behind SNAP, makes it possible for all school students in the United States to receive nutritious lunch every school day. The vast majority of schools, approximately 95%, participate in the program, providing meals to more than 30 million children on an average day. So, any public school, nonprofit, private school, or residential child care institution can participate in the program and receive federal funds. I feel like we read that too. But anyway, so on to the next one. This one is the Child and Adult Care Food Program, which we talked about a little bit already. Okay, so it says new USDA rules for meals and snacks in the Child and Adult Care Food Program go into effect, promote healthy eating habits. So as of October 1, all children and adult care centers and child care homes receiving federal funds from the Child and Adult Care Food Program must implement new nutrition standards that include a greater variety of vegetables and fruit, more whole grains, and less added sugar and saturated fat. The new standards also encourage breastfeeding and better align with WIC and other child nutrition programs such as school breakfast and lunch. And then they have some more information that you can come on here and read for yourselves. And it says, to be eligible to participate in this program, a sponsor must be a licensed or approved child care provider or public or non-profit private school which provides organized child care programs for children in school during off-school hours. Any child up to age 12 or adult attending a participating adult daycare facility is entitled to meals. Programs eligible for participation include non-residential child or adult care institutions such as the group or family child care, child or adult care centers, Head Start, recreation centers, settlement houses, and after-school programs. For-profit child care centers serving 25% or more low-income children are also eligible. So, and then they get reimbursed, and I'll let you read that for yourselves. Then there is the summer nutrition programs. When school lets out, millions of low-income children lose access to the school breakfast, lunches, and after-school snacks and meals they receive during the regular school year. The summer nutrition program helps fill this gap by providing free meals and snacks to children who might otherwise go hungry. I'm familiar with this just a little bit from when I worked with the transitional housing while I was in grad school. Let's see. What information do they have about this? It's basically like certain sites, and this is not on the website, but this is just from what I know. Certain sites, it could be a school, it could be a church, or whatever else, is given funds to purchase like peanut butter and jelly and bread and that kind of thing, fruits, milk, and that kind of thing, and they serve lunch every day at those sites for kids in certain neighborhoods and programs and that kind of thing. So that's technically what it is. What else is on here? A CEP, we already talked about that. There's a fact sheet on CEP also, and it talks about who benefits from CEP, who can participate. I'll put that link to that in the description box too, so you can have direct access to that. We already talked about SNAP, and what is this? WIC. So WIC is Women, Infants, and Children. The Special Supplemental Nutrition Program for Women, Infants, and Children provides federal grants to states for supplemental foods, healthcare referrals, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to age 5 who are found to be at nutritional risk. So that's what the WIC program is. Some of you may already be familiar with this, but WIC is, you get certain cereals and juices and milk and that kind of thing, and like they said, healthcare referrals. And I just remember, I think we had WIC. We used to get Juicy Juice, King Vitamin cereal, that kind of stuff. So it's not anything, and it's actually very sugary kind of stuff. So I'm pretty sure they probably have changed that stuff since way back in the 90s. But that's what that is. And TANF is Temporary Assistance for Needy Families. This information is from benefits.gov. The agency that heads this up is the U.S. Department of Health and Human Services. So TANF, Temporary Assistance for Needy Families program, provides grant funds to states and territories to provide families with financial assistance and related support services. State-administered programs may include child care assistance, job preparation, and work assistance. In order to qualify for this benefit program, the applicant must either be pregnant or responsible for a child under 19 years of age. Also, the applicant must be a U.S. national citizen, legal alien, or a permanent resident, have low or very low income, and be underemployed, working for very low wages, unemployed, or about to become unemployed. So they're making it clear here that you have to be either low or very low income, working for very low wages. So this is for people who are just, maybe someone that is working under the table. I guess I don't even know what to give as an example. So, but I guess if they're working under the table, they wouldn't be able to provide the information on their income. So maybe that wasn't a good example. But, someone who's working maybe as a waitress, making, I think it used to be $2.13 an hour if you were waitressing back when I was in high school, and that's when the minimum wage was $5.15 an hour. I can't believe I worked for $5.15 an hour, but that was in high school. So I guess it would be for like very, very low wages, like they said. And then they tell you how you can apply for the program on here. Then they have family planning services, another thing that's on benefits.gov. This benefits.gov website is good because you can go on here and do kind of like an assessment, and it asks you a few questions, and then you can see what you qualify for, or what your clients qualify for, or what you might qualify for. The purpose of the Family Planning Services Program is to assist in the establishment and operation of voluntary family planning projects, which consists of the educational, comprehensive medical, and social services necessary to aid individuals to determine freely the number and spacing of their children. In order to qualify for this benefit program, you must characterize your financial situation as low income. You must characterize your financial situation as very low income. You or your family/household member must be pregnant, or you must be a parent or primary caregiver responsible for children under the age of 19. And then they also give you some information on how to apply and a contact for the program. Then another one that I thought about too as I was thinking about benefit programs is LIHEAP. That's the Low Income Home Energy Assistance Program. That is headed by the Department of Health and Human Services. LIHEAP is basically when they give you assistance to pay for your energy bills, your utility bills. They might pay a security deposit to get something turned on. They might pay a past due bill if you're able to provide information and documentation that you can sustain the bill once they pay in this crisis situation. They do weatherization, so they do like fixing the roofs and insulation and fixing the HVAC systems and that kind of thing. So it says the LIHEAP program helps keep families safe and healthy through initiatives that assist families with energy costs. We provide federally funded assistance in managing costs associated with home energy bills, energy crisis, weatherization, and energy-related minor home repairs. LIHEAP can help you stay warm in the winter and cool in the summer through programs that reduce the risk of health and safety problems that arise from unsafe heating and cooling practices. So a lot of elderly people use this program. Here where I'm from, it's administered through SHARE, which is a program that is also through Head Start, or I guess correlated or connected to Head Start programs here. And they have a lot of other services. These are like block grants that they give out to the community. So let's see. Target population for LIHEAP, they must cap LIHEAP income eligibility at no more than the greatest of 150% of the federal poverty guidelines, or 60% of the state median income, and no less than 110% of the federal poverty guidelines. They must also give higher benefits to households with the greatest home energy need in relation to household income and number of household members. Grantees must also target benefits to households with elderly members, disabled members, and or households with young children. So then they go on to talk about these block grants and leveraging incentive program, residential energy assistance challenge program, which I didn't know what that was, but when I read it, it says the law allows Health and Human Services to award supplemental LIHEAP funding for current grantees to receive competitive grants to implement through local community-based agencies innovative plans to help LIHEAP eligible households reduce their home energy vulnerability, and then emergency contingency funds. It's a block grant, and it says all 50 states, the District of Columbia, 5 U.S. territories, and over 150 tribes and tribal organizations receive LIHEAP grants each year. So I know this is a super long video, so I won't continue to give you more and more, but these are just some programs that I've come across on a regular basis working with people in the field as a case manager when I worked in Columbia with homeless families, and even now that I work with the elderly population with chronic conditions and that kind of thing. So hopefully this has been helpful for you. Like, share, subscribe to the channel, share with your colleagues and friends, and hopefully I'm not talking too fast. I just don't want to make the video super long. It's already 30 minutes, but I think this is some good information. Again, if not for the exam, then just for general knowledge as a social worker. And again, do your research on your own and see what it is specifically to your state, how they allocate these funds, and if they allocate those funds. So until next video, I will see you all later.